Diet for bronchial asthma. Interesting about science and medicine. Prepared by editors of the channels, all scientific. Diet is one of the most important methods of treating bronchial asthma. It was found that main cause of bronchial asthmatic attacks is some foreign proteins that re-enter the body. These proteins may be of food origin. What is forbidden to eat if you have bronchial asthma? Also, the diet of patients with bronchial asthma should contain a limited amount of protein even if the patient experiences increased sensitivity to plant products origin. It also recommended to limit the consumption of extractive food rich in purines and strong fish and meat broths. Even if there are no indications of intolerance to certain foods, a hypoallergenic diet is recommended in the presence of any type of bronchial asthma. First of all, you should exclude from the menu products with non-specific irritant properties, salt and spicy foods, mustard, pepper and other spicy, products with increased antigenic activity, nuts, crayfish, crabs, fish, citrus fruits, eggs. You will need to limit your diet products that promote the release of histamine, strong tea, coffee, red-made seasonings, alcohol, strong fish and meat broths, nuts, peanuts, tomatoes, chocolate, bananas, strawberry, crustaceans, food containing histamine, sauerkrauts, tomatoes, spinach, smoked meats, canned food, wine, cheeses, pickled herring, caviar, salami. If a patient has intolerance to aspirin, acetyl salicylic acid, it is recommended to exclude food rich in salicylate from the diet: apples, gooseberry, apricots, raspberry. Alcoholic drinks are strictly contraindicated for patients with bronchial asthma. Alcohol increases the permeability of the intestinal pulmonary barrier to food allergens. Patients should also limit their intake of sugar and liquid, and of course salt, in severe cases up to 4-5 grams per day. What should you eat if you have asthma? Outside the period of exacerbation of disease, patient's diet should be complete but without excess. For bronchial asthma, a low-calorie diet is recommended, rich in foods that have an enterosorption effect, in other words, containing a lot of pectin in dietary fiber. Analyzing individual tolerance, it is recommended to include in diet the following food rich in pectin and dietary fiber: wild edible herbs, seaweed, hair cabbage, plantain, primrose, fireweed, chicory, sorrel, nettle, seasonal fruit and berry, dried fruits, vegetables, legume, patisons, zucchini, white and cauliflower, cabbage, parsnips, celery, borage, coriander, dill, parsley, wild garlic, onion, pumpkin, beets, carrot, all grains and cereal made from them, rice, millet, barley, pearl barley, oatmeal, buckwheat. Patients with asthma should eat food containing vitamin A, B, C, group B, phosphorus, and calcium salts. Food allergens and bronchial asthma. Nutritional therapy for asthma is especially important in cases where food allergy are the causative agent of a disease or increase the symptoms of a disease. For each patient, the diet is considered individually, taking into account intolerance to individual foods. For patients with this disease, therapeutic diets must be formulated with detailed and clear instructions regarding which substance and food should be excluded from the diet. It is important to know that some airborne inhalant allergens are very similar in their properties to certain food. There are many such examples: sunflower and wormwood pollen, walnut and hazel pollen, food grains and grass pollen. Patients sensitive to these types of allergy should be exclude relevant food from their diet during an exacerbation of disease. For patients suffering from bronchial asthma, split meals are recommended at least 5 times a day. You should take food in small portions and take your last meal at least 2 hours before bedtime. On average, the diet of a patient with bronchial asthma should contain 800-1000 ml of free liquid, no more than 7-8 grams of table salt, 300 grams of carbohydrates, 70 grams of fat, 100 grams protein. The total weight of products consumed per day should be on average 3 kilograms and the energy value should be 2250 kilocalories. Eat food at normal temperature. Thank you for your attention. This material was prepared based on material from the channel All Scientifical. Attention, before using various treatment and remedy, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.